Good morning, Swiss Society of Cardiology. I am Claudia Herrera from CHUV in Lausanne, and today I'm going to talk about the causes of recurrence after stereotactic radio-ablation of refractory ventricular tachycardia. So far in CHUV, we have treated 12 patients with this very new technique for refractory ventricular tachycardia. As you see in this graphic, with very variated substrate, all of them wearing a defibrillator, and all of them having already underwent many trials with antiarrhythmic drugs, with many ablation, with also complex techniques. As you see, it was a very sick group of patients. 3/4 of them had already had one or more electrical storms, and almost half of them presented acutely with an electrical storm at the moment of radioablation. 3 of them, 1/4, were even intubated at the intensive care unit because of incessant shocks. Once we had taken the decision to treat the patients, we performed a very detailed mapping with the Carter system to delineate the clinical tachycardia, and taking these and the information of the available imaging, most of them MRI, we performed a planning of the treatment volume with the CyberKnife system. Here you can see this planning of the therapy with the isodoses, with the core, which is going to receive the whole dose of radiation. This is an image of the CyberKnife system, which has a robotic arm allowing us to follow the lead of the defibrillator to compensate for respiratory movements. These are the characteristics of the radiation that we performed. As you can see, in 10 of our 12 patients, the treated volume involved the interventricular septums. Adverse effects due to radiation were very low, and notably, no patient presented an AV block after radiation. Unfortunately, all patients presented some kind of recurrence after the treatment. 10 out of 12 presented sustained ventricular tachycardia during follow-up. 3 were treated just with antiarrhythmic drugs. 8 had to receive repeat catheter ablation, and even 1 patient underwent a second radiotherapy of the area. Concerning the site of recurrence, 5 out of these 10 patients that have had a recurrence outside of the treated volume, 2 of them at the border of the treated volume, and just 1 inside of the treated volume. And this was a patient where the area that we wanted to treat was very near to a coronary artery, and just limited us to give the full doses in a part of the area. So in conclusion, stereotactic radioablation is a therapy that works well in this very ill group of patients, that was able to limit the VT burden, was enabled us to taper down antiarrhythmic drugs or even stop them for a certain while. But quite a lot of these patients present with recurrences, mainly due to ventricular tachycardia that come out of other regions outside of our treated volume. Possible other limitations are anatomical structures that limit us to give the full doses at the spot where we would like to, and maybe areas also with a very, very marked fibrosis. Thank you very much.